happy National Rural Healthcare Day. Actually, every day should be National Rural Healthcare Day, but we're going to have a special day to celebrate rural healthcare, and we should. So first thing I want to do is really a shout out to all of our providers, all of our clinicians, our support staff, everybody who is involved in rural healthcare and their commitment to taking care of people, to working in rural communities to ensure that people who have great needs are taken care of, that are there to serve, that are making sure that every day is really a great day in a rural community for our hospitals, for our community, for the patients that we serve. I think what's, as I've been reflecting on, rural health, a couple of thoughts, that I wanted to share. One is I'm really happy that just in recent times, maybe the last, year or two, has rural healthcare really come to the forefront, both at the state and at the federal level in, conversations in Congress and also in our legislature here, in Minnesota. I think sometimes we can just take it for granted. The hospitals are fine. They're always there. They're always taking care of people. They're fine. But the reality is that's not the case. And we have seen, over time, more and more rural hospitals be on the brink and to the point of closing and or loss of a lot of particular programs and services. And so we're starting to see the unraveling, if you will. And the fact of the matter is, rural healthcare is the backbone of the entire healthcare ecosystem. And we have to get to, where people live. And healthcare really it's a people business. It is a one-to-one sort of exchange. It's very personal, and it is at the community level. It's one of the things that I love and why I work, in rural healthcare is we are so close to the work that we do and the impact that we make in people's lives and in our community really as a whole. So I am very pleased that we've really seen that kind of heightened awareness of the struggles and the fragility, if you will, of rural healthcare. And I'm not saying that bigger organizations and systems don't have issues. In fact, that they do. But I think rural is really the leading edge. We feel it first. We experience it, changes first. This is where I think we see as a country where things can happen. So, rural is that important as an indicator, I think, of the whole ecosystem. But more important to that, we are so embedded and entwined in our community and the people that we serve that you just can't kind of separate it. You don't know where kind of the organization starts and stops and where the community starts and stops. It's why we say we are Winona, because we are the community. That's, not just who we serve, but it is, who works in our organization and who's here to care for you on any given day. I have a lot of excitement about, the future for rural. I think it is, as I've just stated, I think it's critically important. But for Winona Health in particular, we've just got some very exciting things going on, despite all the changes that are happening in the industry around us and the changes that are coming down the pike. We'll navigate those as we have for more than 130 years. As I say all the time, we don't practice medicine and we don't deliver healthcare as we did 130 years ago or even 50 years ago. We're always changing and evolving to meet our community's needs and to bring in what's the next best, approach for healthcare, because there's some really great advancements that have happened, over the decades. And patients really are the recipient of all of those benefits. But we have been very fortunate to really attract, because of our beautiful community and all we have to offer collectively, a lot of great new providers across a lot of different services, and just really wanting to expand our reach and the number of services that we can provide to our community. So in particular, in some of the specialty areas that we'll be rolling out with cardiology and rheumatology, urology, and some of the other ologies. And as those come into play, we'll be making sure that everybody has got more awareness around all of that. But we've also built built out, more of our primary care because, frankly, everything starts with primary care. So if you don't have a PCP, a primary care physician, I am going to tell you, go out and get yourself a primary care provider. We have some awesome ones, here that are waiting to take care of you and follow you through really the life cycle of everything that goes on in people's lives from a healthcare perspective. That's the beauty of, I think, primary care and rural healthcare. Probably 80+% of what anybody needs, we can do. And I think the breadth of services that we have here at Winona Health, we're incredibly fortunate. And I am incredibly fortunate to get to work with such talented individuals really across the spectrum. On top of that, we continue with all of our relationships across the schools and businesses, not-for-profit agencies, the county, the city. Our connections run deep and wide across this entire community, and we are so grateful for those partnerships that we have. We're so grateful for the collaborations when we find programs to work together that further the reach or get services to parts of our community that haven't had maybe as much access. Those are all really great opportunities for us, and we come together collectively to deliver on that promise that we have. We have always considered Winona Health an asset of this community. This is a community-owned asset. That's why we're not part of a system. We work with the systems. Of course, those are our referral centers. But this is an asset of this community, and it's why we're so clear about who we are, who we serve, and what services need to be here for you, because it's defined by who is, what the community needs are, if you will. And rolling into all of that is just our community benefits. So one of the great things that we're able to do as a not-for-profit healthcare system is provide back to the community. So we do that in a lot of different ways. Our patient care fund is probably one of our biggest ways, where people who have financial needs, we have in our foundation, we have some assets in there that can help and support folks. There's a whole process around all of that, and every year it's over $500,000 that goes back to individuals in our community to offset some of those medical expenses. We have our simulation lab, which is a reach that we've been able to extend out to students in schools, to EMTs, to fire departments, to students in other programs, to our own staff, just to continue the education and advancing knowledge, if you will, in terms of healthcare delivery. So that's been a great asset, and in partnership also with Winona State, who has their simulation lab extended over here as well. We provide, we're a training center for all kinds of different clinical specialties. So we have students here on a regular basis from universities, not just here in Winona, but from quite a far reach. We have medical students that come and do rotations. There's nurses, there's lab techs, there's CRNAs, there's surgical folks, there's therapists, there's PT and OT. The list goes on. This is an awesome clinical training ground for rural, and with individuals here who are really embracing having new folks coming in, new ideas, and being able to pass on that expertise. So there's just a wide array of things that we do here. It's hard to capture it in sort of a short video here, but the value of a rural community healthcare system, our hospital, our senior services, our clinics, all of those kinds of things. I don't want us to ever take it for granted or think that nothing can ever change us. We are very diligent and on constant alert for all the changes of things that are happening. But at the core of it, it is really about being here to serve this community in your times of need, to your extended families, friends, neighbors, all of that. It's a privilege for me. It's a privilege for all of us in this organization to be here in service to all of you. So with all that said, I want to again congratulate all of the folks that work in rural healthcare, and thank them for their service in doing that, and thank our community for the support that has been provided to this organization to be here for all of you, our family, friends, and neighbors. Thank you.